Welcome to Open Door Health Services. We would like to walk you through what to expect when becoming a new patient to help you feel more comfortable seeking care. When calling Open Door to set up an appointment for a regular checkup or for a sick visit, the person you talk to may ask a few questions about the type of care you're needing. If you are a new patient, they will ask a series of questions to connect you with the best department for your care. If you would prefer to see a male or female provider, you can mention that during your initial call. A provider is a doctor or nurse practitioner. Both types of providers are experts at what they do and are able to diagnose illnesses, prescribe medicines, provide annual checkups, and manage any long-term concerns. A primary care provider is the provider you'll be matched up with for your continued care. At health centers like Open Door, where several providers work in one building, you might be scheduled with another provider if yours would happen to be unavailable the day you want to be seen for an illness. During the phone call, the scheduler will make you an appointment. It would be helpful to have your calendar or availability ready. Before your scheduled appointment, you will receive a text or email with some short forms to fill out. If you don't have a way to fill it out before your visit, don't worry. You can complete it in person at your visit. When arriving at Open Door, please check in at the front desk. They will ask for your name, date of birth, insurance card, if you have insurance, and ID. If you didn't have a chance to fill out your forms ahead of time, our staff will provide them for you to complete at this time. For those without insurance, you'll have the opportunity to speak with someone who can walk you through affordable options and help you apply. These people are called navigators. The person checking you in will also share information about our sliding fee discounts. These are discounts you may qualify for based on household size and income. We never want payment to stand in the way of your care. Please speak to one of our staff if you have concerns about payment. After checking in, our staff will show you where to sit while you wait for your appointment. A medical assistant, also called an MA, will call your name when it's time to go back to the exam room. The MA will start your visit by taking your vitals, which can include measuring your height, weight, blood pressure, temperature, pulse, and oxygen levels. This is important information for your provider to know as part of your care. The MA will also ask a few questions about your health history and family history, as well as some questions about your home, work, or school life. This helps our staff know if there are resources outside of this visit that we can connect you to. Any information shared is confidential and is used to provide the best care possible. Some of the topics that may be brought up are family history, medications, depression and anxiety, sexual activity, last menstrual cycle, and home life. Not everyone will know all the answers to these questions. Just provide what you can. Once the MA has completed their part of the visit, they will leave the room and notify the provider that you are ready. You will wait in the exam room while the provider reviews your chart. The provider will come into the room to see you and ask what brings you in today. The physical examination could include listening to your heart and lungs, looking in your nose, mouth, and ears, feeling and listening to your stomach, and feeling for pulses on your feet. Every exam is different depending on the reason for your visit. They will discuss any medication you are on and will want to know the name of any medications, dosage, and how often the medication is taken. If the provider recommends blood work or immunizations, those can be done on site immediately following your visit at some Open Door locations. If it's not done on site, our team will let you know where to go for it. Sending you to another site for a service is called a referral. Your provider will leave you with an explanation of any next steps and any medications they might prescribe. Providers keep records of your visits, medications, and information related to your care. When you come back for your next visit, they'll have access to that information from past visits. At Open Door, you're able to ask the cost of any services provided on site prior to receiving the service. Either call us in advance or ask within your visit the cost of anything your provider recommended. When you're finished with your visit, a staff member will show you to the checkout desk where they may schedule a follow-up appointment if needed. If you have health insurance, also called health coverage, you may be asked to pay a small fee called a copay. The rest of your bill is sent to your insurance company. They pay their portion, and then you will be sent a bill for any portion you may still owe. If you do not have health coverage, you'll be asked to pay a small fee, known as a nominal fee, at the end of your visit. Our sliding fee scale is used for all uninsured patients. However, even those patients with insurance can apply for our sliding fee discount if they meet the income and household size eligibility. If you have concerns about being able to afford a service or medication, please let us know. There are several ways we can make care affordable for everyone. At Open Door, you'll still receive care even if you have trouble paying. We don't turn anyone away for an inability to pay. As we mentioned earlier, Open Door has staff on site who can assist with a variety of resources to care for your whole person health, including connecting you with resources for housing, food, employment, health insurance enrollment, and behavioral health. If you're interested in any of these resources or additional types of care at your visit, mention it to any team member, and they can get you connected with the right person to talk to. We hope this has helped you feel confident and comfortable initiating your first visit or coming back for continued care. Open Door's mission is to improve the lives of others. We hope to welcome you soon.